Okie dokie, Mr. Face for you out there. Lovely pitch, no tutorial, and he says, we love Africa, and you know we love Africa. No matter how you see it, ups and downs, situation shifts, and what have you, we still love where we come from because nowhere else like home. That's what it is. A big shout out to my brother, Mr. Five. Who else is that? A couple of weeks back here, okay? Our heartfelt sympathy goes out to you, my brother. Yeah. Now, talking about loving us and loving our continent and loving where we come from, you know that cannot be possible without good health. And that is why we have people called the pharmacists who work in conjunction with medical doctors and personnel just to ensure that we live healthy and we're good whenever we have trouble with our health. Today seems to be their day, World Pharmacy Day. And being an entertainment show, I was like, let's take a break and celebrate these guys on a Saturday, on the weekend. The team is Pharmacy. Watching, I have to do this now. Yeah. Pharmacy, always trusted for your health. Yeah. Pharmacy, always trusted for your health. And I'm like, okay, let's narrow this down to where we are: Africa, Nigeria, Benin City, and those as the case may be. With the ongoings and happenings, reports of adulterated drugs, medicines, and all of that. Can we still be able to trust you guys, pharmacists? Good morning, guys. I have Mr. John Bosco. Good morning. How you doing? Bros, what's your name?
Dr. Isibo is my name.
Okay, Dr. Isibo, yeah. Welcome to the staff of the show. Once again, happy Pharmacy Day to you guys.
Thank you.
So like I did say, right, yes, I mean, with several reports and busting of adulterated drugs and all of that. I'm not saying you guys sell, do you know what I mean? I'm just like, that is the impression we have, so to speak, and I know you people are doing everything possible to curb this. Can we still really wholeheartedly say we trust the business of pharmacy in our lives?
Like you said now, you called it the business of pharmacy, but we don't see it as a business of pharmacy. Yeah, we see it as a practice of the profession. We don't call it business, we call it practice of our profession,
really?
Pharmacy.
I must say I never knew this till now.
Yes.
Thanks for educating me on that one.
Thank you very much.
So
like you rightly asked if we can still trust the pharmacists. Yes, the big capital YES, yes. And we are doing all we can to curb these fake drugs that we have in the country. Like I will always tell you, because a pharmacist is well trained, passed through school, and in fact, the kind of trainings we have, we cannot, I use the word, we cannot indulge in anything fake because we know the consequence of taking fake drug. Just imagine someone that is hypertensive or someone that is asthmatic and he has an asthmatic attack. Taking a fake drug, what would that end? Probably will end the person in the grave. So because of that, we know the consequences. You see, the money actually is not really our goal, our focus. It's the practice that is our focus. You see, when you use the word business, we don't see it as business. We see it as practice. So the practice is our business. But now, when you allow, like Nigeria context, you allow non-professionals into the profession, into the business, as you said, people coming in to make business out of drugs, then they will indulge in so many things. Their goal is money, profit, while our goal is good health. So you see, we cannot afford to give fake drug. But when you allow, like Nigeria context we have now, they allow non-professionals into the business, and by so doing, they make the best profit out of it, and by giving fake drugs. And that is why we keep fighting it from policies, because we've come out with a proposal to the federal government. Even it has even gone through the Senate, and but I think at the time it was now left for the president to ascend his signature. But to make it a law, that was where the thing got stopped.
Okay. If
that thing has passed that stage, all these issues of fake drugs would have long been eliminated, not completely eliminated, but at least reduced to the.
Now, let me ask Isibo, what were these proposals you just talked about that is yet to be assented by the president?
Well, to add to what he has just said, you see, as pharmacists, we are drug information experts, and that is why we advise the populace to procure their medications, their drugs, from registered pharmacy outlets. Because that is the best way. That is the only way you can actually get the services of pharmacists. You can get the best out of your drugs. Because we are actually there to ensure that people get the best out of their medication. Now, here I said about the ASEAN. Well, there's a B before the president, which is the pharmacy B. And there are a lot of things in that bill. And we are very hopeful that once that bill is assented to, a lot of sanitization will occur, will take place.
100%.
Yes, very well. So we are sure and we are confident that that will happen.
All right. If I may add to what he just said, one of them is this open market. This open market, the one we have at Ariariam, Onitsha, Idumota, those things are not supposed to be there. You have
something like a black market now, you mean?
Not black market, we call it open market. You don't just walk to, you don't sell drugs as they sell tomatoes in the market. But when you go to this place, you see some drugs that are supposed to be kept in the fridge, refrigerated. They are put outside, sampled outside for people to see, exposed to the sun. So you see all these things, they may not be fake, but they have lost their potency. You understand? So all these things are what we put together in that bill for government to regulate so that the populace, the general public, get the best out of their medicines.
Okay, all right, good one. Now let's come home now to the present, like, you know, everyone's concern have to do with COVID-19 and its vaccination. Like, it's ongoing right now. You must get vaccinated by the state government, have the card, a green card, or else you might not be allowed to do and go to some certain places, as the case may be. But some people are saying that even after being vaccinated, some people now are saying after being vaccinated, they still find themselves still contracting this, you know, ailment at the end of the day. So I want to know from you guys, as you know, practitioners, is it worth it?
Okay, super.
Well, yes, to answer your question, the answer is yes, it is worth it. There is need for one to be vaccinated because you see that there are some of these childhood illnesses like cholera, like diphtheria, and the rest of them. These illnesses have been able to be put at bay as a result of vaccination. And as such, there is need for people to get vaccinated. Although we are very much aware that this COVID-19 is a novel disease, but however, there is need for people to get vaccinated so that the rate of transmission, so that it can curtail the spread of the virus.
But whereby even some of the manufacturers decline vaccinating themselves with what they've manufactured, like we've read and heard in the past. What do you make of that?
I actually want to believe that there are so many conspiracy theories concerning this.
Yes, lots of it, man.
Yes, concerning. So what we need to do is that we need to get the right information. That is why some of us are here. We need to get the right information from professionals, from people who are into this research, who have the evidence of how vaccines and medicines work, so that we can, as a matter of fact, key into this vaccination.
There are fears in some certain areas, you know, that after now, you might start hearing of fake vaccines. Do you ever see this happening, John Bosco, from your experience?
You see, like I said before, because you've allowed non-professionals into the business,
yes,
people will definitely take advantage of the prevailing situation.
Yes.
We've had in Edo State now that they've started having fake cards.
Fake cards, that was actually where I was headed.
So you see, people always take advantage of situations. It's possible because we've also heard in the news that there was a time there was an influx of fake vaccines, but the government intercepted it and I think destroyed it. Yes, there is possibility, but I don't think if you want to take your vaccination from an accredited facilities, then you must have the genuine one, because the genuine will definitely get to that accredited facility. There is no way the fake one will get there. There is no way.
So that's being handled,
because it's being handled by pharmacists, right from the production down to the
user,
through the logistics down to the user. It go through the pharmacist, so you definitely not get, except you go to maybe shops to buy or registered premises to get. That's where you can get. But if it's the facility, you definitely get the correct one.
Will you say the policies put in place so far, you know, is adequate enough?
Well, it's adequate. I would say it's adequate because it's just for people to key into, to do the right thing. and also ensure that they follow the instructions that have been given by policymakers. Because the way I see it is that government is a kind of teamwork. It's something that everybody needs the collaboration of everybody.
Yeah.
The government have their role to play. The followers also have their role to play. So we need to listen to the instructions that are given by the policymakers, and so that things can actually work adequately well for every one of us.
All right. Okay, so let's go back to your team again. Always trust on you guys, man. What plan do you have today to hit this trust into the minds of many and the populace? Bosco.
We have a lot of programs lined out today to really educate and also advocate and also tell the general public the roles pharmacists play to ensure good health to the general public. One of them is we'll have a road show. We'll also have, I think at this market, Uselo market, we are going to have a section where we educate the public on issues and even on our roles. Let them know the roles we play. Because most times we discovered that most people, even when a pharmacist attends to you, you still think it's the doctor. Yes. Although they are
that
all,
is very,
yes.
That is something you guys have to
We want to
on.
make them know that this is a pharmacist, this is a doctor, this is the care we give you as regards your medicines is the pharmacist.
Okay.
Yeah.
All right. Good, man. Well, I really wish you guys the best one, you know. Knowing that today is your day and you have a whole lot, you know, lined up in educating the people, the populace, on how to be healthy. And like you did say, draw a thin line between doctors and pharmacists. Yeah, because most at times we get caught in that web. We call all of you doctors. It's doctors like medical, you know, practitioners and personnel. I must thank you so much, you know, for stopping by, and once again, congratulations on your day, on your team. Does this thing really mean so much to you guys? Like, I don't know, like being a body. Are you guys contented before this team is being adopted by the international body? I want to know how it plays out. Okay.
Well, the team is actually selected by the International Pharmaceutical Federation. That is the global umbrella body of pharmacists.
Like what I mean, is there a brainstorm section?
Yes, it's actually done by the council of FIP. And it is based on the prevailing circumstances. Okay. Now we are in a pandemic era, so it is chosen. It is actually apt and unique. The team is unique and apt, considering the distrust and mistrust concerning the COVID vaccines and the pandemic. So that is, that is why.
All right. Is there one or two things you want to chip in before we wrap up? Because time is far gone.
Well, very quickly, before we wrap up, I want to advise the public that pharmacists are trained experts in drugs, in the use of drugs. And as such, when it comes to procuring your drugs, medicines and drugs. So they have that in line. In terms of procuring your medicines, please try as much as possible to patronize registered pharmacy.
And not open market.
Not open market. Because there you will get the best and you will get the services of a pharmacist who will educate and counsel you on the use of drugs.
All right. Thank you very, very much for stopping by and coming to share your time with us, educating us on how to go about our health, so to speak. Because at the end of the day, when you get into the wrong hands, things get even messier than you thought it was. Yes. Proud of beating the wrong hands. Once again, thanks so much for stopping by. All right, it's still the Saturday show. Yes, it's all about entertainment, education, and information. Those are the keys, the three key elements of the business. That is how we try to balance it right here.